In this podcast episode, Abigail Shrier, a journalist and author, discusses the increasing focus on mental health in the public school system and the potential dangers of over-validating every emotion children express. She highlights the crisis in mental health therapy, focusing on emerging therapeutic practices and ideologies that prioritize affirmation over critical assessment and care. Shrier points out that parents are increasingly relying on therapists and school counselors to address parenting problems, leading to a lack of confidence in disciplining their children. This trend has been influenced by therapeutic experts who have convinced parents that discipline may traumatize their children, resulting in a culture of overdiagnosis and overtherapy. Shrier argues that the rise in mental health issues among children cannot be solely attributed to social media, as similar trends have been observed since the 1950s. She emphasizes the importance of children feeling connected to family, being engaged in something bigger than themselves, and having a sense of independence that includes some level of risk and danger. She acknowledges the impact of family instability, including fatherlessness, but also highlights the significance of parents exercising authority and setting boundaries for their children. Shrier challenges the notion that increased awareness and diagnosis of mental health issues are solely responsible for the rise in adolescent mental health problems. She points out that rumination, a symptom of depression, has increased among young people, along with a focus on feelings and emotions. This constant focus on emotions has led to a generation of kids who are emotionally dysregulated and unable to cope with real-world challenges. Shrier also addresses the role of fathers in setting boundaries and providing discipline in the family. She notes that the absence of a father figure, or a father who fails to fulfill the role of setting rules and boundaries, can have a detrimental impact on children, especially teenage boys who may not respond to maternal authority in the same way. Shrier suggests that the lack of traditional family structures and the decreasing number of children in society may contribute to the disconnect between those in positions of power in education and the needs of children. She highlights the importance of having a balance of masculine and feminine attributes in parenting, with fathers providing justice and discipline, while mothers offer empathy and support. Shrier criticizes the trend of treating children like small adults and adults like children, leading to a lack of independence and resilience in kids. She points out that children need structure, rules, and responsibilities to thrive, and that parents should not be afraid to discipline their children when necessary. The conversation then shifts to the pressure on parents to constantly cater to their children's emotional needs and validate their feelings. Shrier criticizes the trend of empathizing with children's every emotion, stating that it can lead to children seeking negative attention to get a reaction from their parents. She advocates for a more authoritative parenting style that balances love and discipline. Shrier also discusses the issue of mental health surveys in schools and the focus on social-emotional learning. She argues that constantly asking children about their mental health and negative feelings can actually increase anxiety and depression in kids. She points out that social-emotional learning programs have been found to have negative effects on teenagers, making them more anxious and alienated from their parents. Shrier addresses the topic of gender dysphoria and suicide rates among transgender youth. She challenges the narrative that bullying and societal discrimination are the main factors contributing to high rates of suicidality among gender dysphoric individuals. She cites a study from Finland that found that when controlling for other factors, the rates of suicidality among transgender youth are not significantly higher than the general teenage population. Shrier criticizes the way mental health issues are being addressed in schools and by professionals outside of school. She highlights the trend of overdiagnosis and overtherapy, where children are being sent to therapists for minor issues that could be resolved through other means. She emphasizes the importance of parents taking a more active role in their children's mental health and not relying solely on therapists to address every problem. Shrier also discusses the impact of societal messaging on young people's mental health. She points out that constant exposure to negative and dark narratives can contribute to feelings of depression and anxiety among young people. She criticizes the normalization and valorization of mental health issues, which can lead to a cycle of self-harm and emotional hypochondria. Shrier delves into the role of responsibility and independence in shaping young people's mental health. She discusses the importance of giving children chores and responsibilities to instill a sense of contribution and independence. She emphasizes the need for parents to communicate their values to their children and assert their authority in guiding them. The conversation also touches on the impact of trauma-focused culture on young people. Shrier argues that shielding children from the hardships faced by previous generations can hinder their ability to cope with challenges and develop resilience. Shrier concludes by urging parents to focus on making their children strong rather than just happy. She emphasizes the importance of instilling values, independence, and a sense of meaning in children to help them navigate the challenges of growing up in today's society.